Hello, my name is Tom Douch and I'm the Chair of the Murrumbidgee Board, and welcome to this virtual annual public meeting. After last year's experience at having a virtual meeting, we thought the virtual format in fact worked very well. It's a great way to get more participation and a wider reach for this important event. So we've gone without a face-to-face meeting in favour of this virtual thing, and we hope that we'll get really good attendance today and that you'll get great benefit out of the meeting. So again, welcome to the meeting, and I hope it is of some benefit to you. When I addressed the annual public meeting 12 months ago, we were in the depths of dealing with the COVID pandemic. But we have come a long way since those very worrying days. We now live with COVID, which I mean the lockdowns and the restrictions of the past are now a fact of history really in many ways. It is true that we are possibly facing a new wave of COVID, but with a wide take-up of vaccinations through our region and a renewed emphasis on protection and a far better understanding of what COVID is all about, the across-the-board shutdowns and lockdowns of 12 months ago seem unlikely to occur this time around. Having said that, there does remain a substantial risk that COVID will affect our operations. Infected clinicians, infected support staff may impact on our ability to undertake and provide services. And this often occurs at short notice. We don't get a lot of warning that someone's going to be infected and unable to work with us. But the plans and strategies to cope with such disruption are now more advanced than they were previously. And although there may be impacts on the MLHD and its capacity to do things, I think we are in a far better position to cope with any challenge that COVID might throw at us. Having mentioned health workforce though, it needs to be recognised that the health workforce within rural areas remains extremely challenging. And that's not just in the Murrumbidgee, but it's across Australia, all of rural Australia. And yet Murrumbidgee, through a very sustained effort by our workforce management, has done quite well. Let me give you an example. We have recruited far more nurses than we would in a normal year over the past 10 months or so. And we've done this through a program of extended recruiting, and we have reconfigured the way we onboard our staff to improve efficiency. We've also developed innovative ways to support particularly new nurses as they settle into their roles and they settle into our system. Another example might be the groundbreaking procedural pathway for young doctors that was developed here in the Murrumbidgee and is now being adopted and rolled out across the nation. It's proven to be so attractive and so successful in our trial that it also attracted funding in the federal budget this year. It's quite a compliment to Murrumbidgee in the way we think ahead. It shows that we don't just sit back and bemoan our challenges, bemoan our workforce challenges, but rather we go out and we try and find solutions and bring them into play. And our results are good. For example, the nursing shortage, which does continue, has improved by about 30% over the last few months simply because of the initiatives that we've undertaken, and that's a good story. Apart from dealing with COVID itself, the consequences of COVID, mainly in terms of workforce availability, have significantly affected clinical operations, as I mentioned a moment ago, but particularly our surgical waiting lists. Our lists have grown quickly as COVID has impacted on the ability of staff to come and be at work. But again, we have not ignored this. We've now developed very thorough plans and have them in place to try and rectify matters, and we have achieved additional funding to help with the solution. The solution being to improve surgical timings and lower the backlog of surgical cases over the next year or so. Prior to COVID, our surgical record in terms of timeliness was second to none, and it's been frustrating for all, for doctors, particularly for surgeons, I know that for a fact, but for all staff and for patients and their families to see surgery cancelled and the backlog of cases grow for reasons largely beyond our control. I expect at next year's annual meeting that a substantial improvement in surgical wait lists will be conveyed to you all because of the plans that we now have in place. You'll all be aware that the last 12 months has been extraordinarily challenging, with COVID and then the persistent wet weather more recently. Of late, flooding has marooned some staff, making it impossible for them to get to work. Some facilities have been under threat from floodwater, and through all this, MLHD staff have been working quietly, undertaking a significant amount of work to ensure that our services are maintained. You all know about the steady deterioration of the roads in our area. I've experienced it this morning as I drove down here. And I'm sure you've all felt the odd pothole or two. Well, that sort of thing has interfered with our ability to transfer our patients across the area and give them timely treatment. We've also had to really extend our cross-border cooperation to support populations on both sides of the Murray River who have been threatened by floods. And this has required really quite considerable effort. But MLHD has done its job. Last year I said to you that a system that scrambles to respond to challenges is not a weak system, but rather it is a system that is showing its resilience, that is showing its adaptability, and is showing its flexibility. And I am proud of what Murrumbidgee has achieved and what is still being achieved as floodwaters remain a threat in many areas. Of course, it does not end as floodwaters drop. For example, the risks arising from a growing or an unprecedented surge in the mosquito population is a matter we will have to contend with, and just goes to illustrate that the tail of this flood crisis may linger for some time after the floodwaters have receded. Now, as we move into 2023, it would seem environmental challenges will continue, and I would like to pause and draw your attention to the environmental credentials of Murrumbidgee, of the MLHD. My sense is we are a leader organisation as we seek to transition from a high waste, high carbon footprint organisation into an environmentally sustainable posture. We have rolled out substantial solar panelling on most of our facilities around the region. We are thereby reducing our demands on the power grid. We are focused on a significant reduction in plastic waste generated by our system, and we are improving the collection of recyclables and the way we use water. We have plans to transfer our fleet across to a totally hybrid fleet of cars. No hospital system can ignore the need to address waste and pollution. And I would expect the results of the initiatives that we are starting to put into place now to produce substantial gains as we move through 2023. Murrumbidgee is doing its bit for the environment, and we recognise that as an important requirement. To change tack a little bit, we would all be very familiar with the challenges we face in terms of inflation. It would be at the forefront at the moment of everyone's mind as we cope with rising prices, rising fuel prices, rising prices of groceries, rising prices of everything. There was a struggle in getting access to things as supply chains seem to be unable to develop well since COVID. You'd probably all be familiar if you go down to your local pharmacy that various medications are in short supply or not even available from time to time, even some of the most common antibiotics. It is a challenge in every respect, and the cost of everything required to run a health system is rising quickly as well. And yet we still have to pay and account for much of the additional expenditure that was required to deal with COVID and now the flooding. Now, 12 months ago, I made another promise. I promised that we would spend some time looking closely at Murrumbidgee's finances. We would undertake a forensic review, if you will. And we would take that discussion and our findings to the New South Wales Ministry of Health. Well, I'm pleased to say we've done that. This was done earlier in the year, and an improved level of understanding and cooperation has been achieved with the Ministry of Health. And for that, we're thankful. In fact, it has realised some specific funding that we wouldn't have otherwise get, but we've been able to get it because we were able to demonstrate that funds are not wasted here in Murrumbidgee, that we undertake expenditure very carefully, and it's continually monitored. We will continue to watch our budgets, the way they are spent, because after all, the money given to Murrumbidgee is the money we all pay through our various taxes. And we should take the appropriate care with that money. We will continue to look for savings, and we'll continue to look for efficiencies, not to close services or to limit activities, but because it's the right thing to do to ensure the money that originally came from us in the form of taxes is spent in the most optimal way. We take this as a very serious responsibility. It's an ongoing task, it never stops, and it's a task which we will not, in fact we cannot, step away from. Now, 2023 is also important because we're heading into a state election in March. The hurly-burly of political campaigning will realise various claims that will be made about our health system. We must be cautious as we listen to these. As chair, I welcome informed criticism and commentary that's based on facts, that's based on the truth, and it's based on good analysis. I will not accept scurrilous commentary and innuendo that derides our staff, that derides our volunteers, or seeks some sort of political gain from the misfortune suffered by ill patients who are presenting to us for treatment. That is a line I draw. But it is the nature of things when dealing with adversity, when dealing with very sick people, trauma, or all that sort of thing, that good outcomes are not always possible. And while we understand this, we don't accept it. Murrumbidgee has always looked to improve. We always review poor outcomes in order to better our service, the sort of service that we provide, and we've always sought to provide the best care possible. We call this clinical governance, and it's highly developed here within Murrumbidgee and is a high priority of the board and will remain a high priority throughout 2023, a high priority and a core focus for the board and the MLHD executive as we move forward. Now, it is important that I acknowledge many people who have made Murrumbidgee a quality, high-functioning health system. We are superbly led by our CE, Jill Ludford, who is very well known across the community and who rightly is widely respected. She's ably supported by a committed and very capable executive who often work quietly in the background, putting substance to the many activities that Murrumbidgee must undertake. I would like to thank our frontline staff, the clinical staff, who have performed so magnificently over the past few years as we have faced crisis after crisis, drought, bushfires, COVID and flood. There are many stories of individuals who have worked double shifts or more, foregone holidays, come back from retirement, and so the list goes on. Frankly, it humbles me when I think of the service and sacrifice that individuals have provided so that we can continue the services of Murrumbidgee. I'd also like to thank our wider team, and this is important. As I've toured around various facilities within Murrumbidgee, it has become clear to me that there is an invaluable role played by our cleaners, our office staff, our security officers, transport workers, cooks, allied health people, patient assistants. There's a variety of people of all manner of occupations and skill, and they're all working for towards one common goal, and that is providing the best possible health care we can to our patients. But it would also be remiss of me not to pay tribute to our volunteers, to our LHACs, the hospital auxiliaries, and the multitude of others who give their time freely to support our health system. As a community, we should be very grateful. We all should be very grateful to these volunteers. So I thank them as well. Finally, I would like to acknowledge the other members of the Murrumbidgee board for their support to me as chair over the last 12 months, for their dedication in undertaking the job of the board. My time as chair is coming to an end after 18 months. It's a legislative requirement and reflects the previous time I've spent on the Murrumbidgee board. The board has worked hard to develop itself, to grow as a group, and although we are waiting for a series of ministerial announcements regarding new board members, I am confident the board is in a strong position to continue its important function as we move into the new year. So again, back to where I started. Thank you for attending this meeting today. Thank you for your interest in delivering healthcare to our region. I urge each of you to remain safe as we move into and through 2023. Thank you.